Hello, I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to provide the Monday, September 20th update on the impact of the COVID-19 pandemic on Mobile County. So since we spoke with you last, we have topped 70,000 cases of COVID-19 in Mobile County. 53 cases were added yesterday, just 53, which is pretty amazing considering where we were just a couple of weeks ago. Again, we have continued to watch the number of cases reported to us continue to decline. And, 53 is a really low number. We often see low numbers after the holidays because of delays in reporting, offices closed and testing center closed on Sunday, some of them, but that is actually a really good number. 0 deaths were reported to us yesterday. The total number of people who have died with COVID-19 is at 1,184. And then yesterday we had 28 new admissions or people hospitalized with a new COVID diagnosis in Mobile County. That brings the cumulative number to 8,641. Yesterday, there were 180 people in the hospital with COVID-19. So that number has been less than 200 in the last 4 days, which is really good news for the hospitals. We hope most of those people are being discharged either to home or to a rehab facility. Of course, we're still continuing to monitor closely the number of deaths. That is a lag measure. Hopefully, we have seen the highest some of the highest numbers of deaths due to our big spikes in July and August, but we shall see. So it does not appear that we have observed or detected a spike because of the Labor Day holiday. Lots of us in the public health community and in the scientific community are pretty surprised at how low the numbers have stayed, and a bit curious as to why that is so, because we know there have been lots of gatherings. We know that the vaccination rate is still low. Yes, we've had a lot of cases, but probably not enough cases to, get us to herd immunity. Some of us are wondering if maybe there's a lot of at-home COVID testing going on that's not being reported to public health. But I believe if that were happening, we, would not see such a dramatic decline in the number of hospitalizations. So again, hopefully we are seeing the sort of natural end of our fourth and largest wave of COVID-19, and that we will stay low forever. That is my hope. So please continue to get vaccinated, wear your mask, distance from others, and stay at home if you're sick. We are still unable to publish some tables and charts that are based on what we call the case date or the infectious date. These are sort of post-report calculations that are done. We get a heavy assist from the state health department on those, and there are some files that we just don't have access to. So in our weekly expanded report, you will see that there are many tables or charts that we were not able to update this week. But again, when we look at the number of cases reported by week, we saw just a dramatic reduction in the number of cases reported to us over the last week compared to the weeks prior. Had gone down, except for that spike, that really weird spike, we'd seen 5 consecutive weeks of reduced numbers of cases reported to us. So that is good news. We've seen how sharply and how continual the decline in the number of hospitalizations are. The number of emergency department visits for COVID-like illness is back down around 4 or 5%. That's really good news that we're not seeing, so much COVID illness in our emergency departments. Again, I mentioned the number of deaths last week, 25. Actually, that's a week old. I'll have to get back with you on the number of deaths reported last week. It looks like that one is missing from our report as well. let's see, and then the percent positive, the percent, of all the COVID tests that are reported to us, what percent of those is positive? That's about 15%, which is lower than it has been in many weeks. But again, we're still far from the 3, 4, 5% positive that we were enjoying in May and June. So we will continue to keep an eye on that. The number of cases in schools seems to be going down slightly, and most jurisdictions are reporting. So again, good news, but a cautious eye on everything that's going on. Okay, some other information. We released some information today, just really just trying to further educate everyone on the availability of monoclonal antibody doses. So last week, the State Health Department provided some information, and we continued reporting that today, that there's been a change in the way the monoclonal antibody treatment for COVID-19 is going to be distributed. We know that Alabama will be getting an allotment, so we likely will not get everything that we asked for. The ordering process has changed, that providers will request the number of doses that they would like for the week from the State Health Department using a survey link. And then when ADPH finds out how much of the monoclonal antibody doses, how many will be allotted to us by the manufacturer, the State Health Department will place that order, will distribute, make decisions, very difficult decisions about what orders to fill partially or wholly, and let those providers know. And then the treatment will ship directly from the manufacturer to the providers, is the way I understand it. So everybody, please, if you think you qualify, if you have COVID, you're within 10 days of symptom onset, and you think that you qualify for monoclonal antibody treatment, please, seek out availability. You can go to alabamapublichealth.gov and go to the COVID dashboard hub and find locations that are providing or have ordered and are providing monoclonal antibody treatment. We want people who will greatly benefit from that potentially life-saving treatment to get it, but we may not have enough for everyone. So just an update on that information for all of you out there. Mark provided me with something that ADPH released last week talking about the production or the development of the vaccine for SARS-CoV-2. And really, the vaccine for our current COVID-19, our which is SARS-CoV-2, that actually began way back in 2002 when SARS-CoV-1 was discovered and caused illnesses and some localized outbreaks and transmission around the world. So way back in 2002, the technology that was used to develop vaccines against SARS-CoV-2 were initiated and have been under development and being researched for those 18 or 19 years. So that's part of the reason why we were able to get to a vaccine so fast for SARS-CoV-2 by applying what we've learned since 2002 for SARS-CoV-1. All right. I wanted to mention on Friday there was a early release of a CDC publication in Morbidity and Mortality Weekly Report that compared effectiveness of Moderna, Pfizer, and Janssen vaccine in preventing hospitalizations in adults without immunocompromising conditions. So this was an evaluation of the ability of the vaccine to prevent hospitalizations among healthy individuals, those who have an intact immune system. And the take-home message for me on this is there's sort of some growing evidence that the Moderna vaccine is ever so slightly more effective against preventing hospitalizations than Pfizer, and they both the mRNA vaccines, Moderna and Pfizer, are slightly better than the Janssen one-dose vaccine at preventing hospitalizations. So let me read the statement, CDC, so I make sure to get it right. Among U.S. adults without immunocompromising conditions, vaccine effectiveness against COVID-19 hospitalization during March 11th through August 15th was higher for the Moderna vaccine, 93%, than the Pfizer vaccine, 88%, and the Janssen vaccine, 71%. I talked last week about some other studies that seem to hint at this, and again, it's each individual study has some limitations and some nuances, but when you start taking multiple studies together, it sort of builds a case for demonstrating some difference. So again, both Moderna and Pfizer, very, very effective at preventing hospitalizations. Janssen vaccine, also really good, but there are some minor differences in those, with Moderna having the highest protection, followed by Pfizer and Janssen. Right, and really no questions this week, which is another, Mark says there's one online. I shouldn't have spoken up so fast. But I was going to say, that's another good indicator that the COVID fog is lifting from Mobile County, so I'm really happy about that. Go ahead, yeah.
Are we now at the point we would see an increase associated with the Labor Day holiday?
Right, so the question is, if there were a spike due to Labor Day, would we have seen it by now? And the answer is yes. So remember that after exposure, people develop disease between 2 and 14 days of being exposed. So if people were exposed on Labor Day, today would have been the 14th day, so the last day of their incubation period. So in order for us to detect that, if there was a spike, anyone who got COVID or got symptoms of COVID would have had to have a diagnostic test during the last 14 days. So that's why I'm saying there was not a spike, or we've not detected a spike, because surveillance relies on people getting tested. Now, looking at the weekly numbers, I don't have any reason to think that a drop in testing is what is contributing to our drop in cases. Because even though we had fewer people tested last week, we still had nearly 6,000 people tested in Mobile County, or Mobile County residents tested, and only 15% of those were positive. Still not great. I want it to be down around 3, 4, 5%. But the testing volume is still high. But yes, if we were going to detect a spike, we would have done that by now. All right, someone saying, I had COVID, do I have antibodies now? Most likely you do have antibodies. So people who get COVID, no matter if they have a mild or severe infection or disease, they will develop some immunity. They'll mount some response against that infection, and you will have antibodies in your system. The unknown is how long those antibodies will last, how many of them your body produced in response to disease, and how well they might protect you from a future infection. So that's why, all those unknowns are why you can't rely on natural antibodies to protect you from a second or a third infection. Someone asking what guidelines are in place for people who cannot take the vaccine. So this is an individual responsibility at this point. It really always has been, although we had some help by things like mask mandates and restricted occupancy and those sorts of things. But we have a vaccine. Very few people are ineligible for the vaccine. But if you are ineligible, let's say you have a severe allergic reaction to some component of the vaccine, then your protections are wearing a mask, keeping your distance from people that you don't know or who aren't vaccinated, avoiding gatherings. Don't go to places where you don't know people or don't know what their vaccine status are. Wash your hands, avoid indoor gatherings, those sorts of things to protect yourself. If you have an allergic reaction, a severe allergic reaction to one of the components of the vaccine, which puts you in a category of being needing to defer vaccination. But again, there are very few people who are ineligible for the vaccine or who can't take it. Most of us, regardless, if you're pregnant, you can get vaccinated. If you're immunocompromised, you should get vaccinated. If you're trying to have a baby or you want to have a baby in the future, get vaccinated. If you're allergic to penicillin, get vaccinated. So there are very few reasons that you would not be able to take the vaccine. Is it okay to be around unvaccinated people if you are vaccinated and you're outside? I think it's okay if you can also layer in some distance. So if you are vaccinated and you want to be outside and there are people maybe at a gathering or at a park that aren't vaccinated, then put some distance between you and other people. Don't shake their hand. Don't hug them. Make sure that they stay at home if they have symptoms or if they've been exposed. I mean, that goes for vaccinated people too. But it is okay to be outside if you layer other precautions with your vaccine status. So be outside, be around less people, wear a mask, distance from them. Okay, there's one more question. I'm getting the one finger from Mark.
If I've had the Pfizer vaccine, can I get the Moderna third shot and she is eligible?
Yeah. So right now, third doses are only approved or only authorized. Sorry, that language still even trips me up. A third dose is authorized for people who are moderately to severely immunocompromised, and you should get a third dose that is the same product as the first two doses that you received. That's the recommendation right now for Pfizer or Moderna. There's not an additional dose recommendation for Johnson & Johnson vaccine at this time, but stay tuned. As you all probably know, FDA met on Friday and recommended that a booster dose be made available to people 65 and over who have underlying medical conditions or their work puts them at high risk for contracting COVID. That is an FDA recommendation. The CDC Advisory Committee on Immunization Practices will likely meet this week to look at the data and make a recommendation to the CDC director. Then once the CDC director reviews the recommendations from ACIP, the final CDC recommendations will be published in the MMWR, and then that will be, an authorized booster dose for those three categories of people. So not yet, but stay tuned. All right, that's it. We will talk to you again on Thursday. Stay safe out there. Have a great week, everyone. And remember to get vaccinated.